So good day, sir. I am Kyla O. Espergoza, a student nurse from Davao Doctors College. So today, I will be applying sterile gown and close gloving. So this technique is recommended for those who are involved in surgical procedures. So before that, I am going to show to you the equipments needed. So first is we have the sterile gloves. Next is the sterile gown, and then the clean flat table, the dry surface, and then the face mask, cap or hood, surgical shoe covers, and lastly, our protective eyewear. So remove the jewelries and other accessories in your arms and wrists, since jewelries and other accessories may harbor microorganisms. Next is making sure that there are no nail extenders, nail polish, and cheap nail polish present, because this can harbor additional microorganisms. Inspect hands for any sores or abrasions, and if there are any sores or abrasions present, report it to your supervisor, since open sores can harbor microorganisms. So wear the following before entering the operating room or the treatment area: the cap, the face mask, the eyewear, and the foot covers. So this is to prevent the strands of hair from falling and to prevent the passage of the germs from the nose and mouth. On the other hand, this is to protect your face from any sprays or splashes of blood from the patient. And lastly, the foot cover reduces the contamination from the shoes. Next is open the sterile bag containing the sterile gown. So this is to keep the gown sterile and allows the nurse who has scrubbed to handle the sterile item. Next is filling out the wrapper open while keeping the inner of the contents sterile. So place the inner gloves package on the sterile field created by the wrapper. So this proper technique in opening glove package while keeping the area sterile prevents the area and the gloves from being contaminated. So we are now to perform thorough surgical hand washing and brushing. So this step decreases the bacterial counts on the hands. Next is reach down the sterile gown package and then lift the folded gown upward and step back away from the table. So this wide margin of safety avoid contamination of the gown. So we are now to hold the folded gown and then locate the neckband. So with both hands, grasp the inside front of the gown just below the neckband. So clean hands can touch inside of the gown without contaminating the outer surface. And next is we must allow the gown to unfold, keeping the inside of the gown toward the body. So we must not touch the outside of the gown with our bare hands, since the outside of the gown is a sterile surface. So with hands at the shoulder level, slip the both arms into the armholes simultaneously. And then we must ask the circulating nurse to bring the gown over your shoulders or over our shoulders by reaching inside the arms with the arm seams and pulling the gown on, leaving the sleeves covering the hands. Next is have the circulating nurse securely tie back the gown at the neck and the waist. So the gown must completely enclose underlying garments. So with hands covered by gown sleeves, open the inner sterile glove package. So with our dominant hand inside the gown cuff, pick up the glove for non-dominant hand by grasping the folded cuff. And then next is extend our non-dominant hand of the forearm with the palms and place the palm of the glove against the palm of the non-dominant hand. Next is grasp the back of the glove cuff with the covered dominant hand and turn the glove cuff over the end of the non-dominant hand and gown cuff. So the seal created by glove cuff over the gown prevents the exit of the microorganisms over the operative sterile field. Next is grasp the top of the glove and underlying gown sleeve with the covered dominant hand. So carefully extend the fingers into the glove, being sure that the glove cuff covers the gown cuff. And glove the dominant hand in the same manner, reversing the hands. So use the glove non-dominant hand to pull on the glove, keeping the hand inside of the sleeve. So the sterile must only touch sterile. Next is to be sure that the fingers are fully extended in both gloves. It ensures that the nurse has full dexterity while using the glove hand. So offer the waist ties to the circulating nurse, or hence the paper tab connecting to the sterile tie to the circulating nurse. So the gown must enclose undergarments.